Hello, my name is Ashanti Clark, and I will be presenting case study 2 for SPCE 683. Here is the list of the task list items that will be discussed throughout the presentation. Task list items are a comprehensive outline of skills and knowledge required for BCBAs by the BACB. The behaviors that we targeted in this case study were noncompliance. Noncompliance was maintained by escape. When the patient engages in noncompliance, the desired activities such as transitioning or independent work are postponed or terminated, making the behavior function under an aversive condition, Chapani 2018. When the patient engages in noncompliance, it is a form of Chapani's diagnostic category direct escape. Direct escape 3.2 lists direct escape as an escape from lengthy tasks, chores, or assignments. For this case study, noncompliance is defined as any instance in which the patient verbally or non-verbally refuses to comply with a request 10 seconds after it's been made. An example of this would be the therapist instructs the patient to put his pencil box away and the patient says no. A non-example of this would be the patient asks to put away his toys after playtime. The patient responds by saying okay, and the therapist proceeds to pick up the toys. Cooper et al. 2020 defines escape as an avoidance contingency. An example of this would be the patient's going inside for cool air because the temperature from the sun is too hot. A non-example would be staying outside when your skin is burning from the heat of the sun. On this slide, we will be discussing interventions used in this case study. I will also be discussing how BACB task list items were incorporated into this case study. Starting with the task list item H3, which states recommend intervention goals and strategies based on such factors as client preferences, supporting environments, risk constraints, and social validity. These are all interventions that have been scientifically proven effective for the treatment for escape behavior. These interventions came about as a direct result of assessments such as the needs identification assessment, questions about behavior, function assessment, function behavior analysis, behavior health index, and direct observation. Going into the second task list item that I'm going to discuss is the task list item H2. This task list item states identify potential interventions based on assessment and results and the best available scientific evidence. And all, like I said before, all of these interventions were brought about from evidence-based research. H1, task list item H1 states that intervention goals and, state intervention goals in observable and measurable terms. Offer the patients options to choose from multiple preferred items and activities. By offering choices to choose from, the client will be completing the targeted goal in the order that he would like to complete them. Task list item E2 is determine when consent and assent should be gained with a client. Giving him those options and those choices helps him have assent in his therapy. Task list item H4 states when a target behavior is to be decreased, select an acceptable alternative behavior to be established or increased. While the interventions are functional behavior replacements for escape, functional communication training, we're teaching him how to ask for a break instead of throwing tantrums and escaping from the task at hand. Using a break card is another way of teaching functional communication and helping him gain that autonomy and using his voice. Offering choices is another way. Using the first then visual board will be displayed to indicate the next activity. It's an antecedent intervention that will help decrease the onstart of the behavior. Um, Displaying a first in poster will offer a visual schedule for the patient to see what activity he will be completing next. And instead of engaging in noncompliance, the patient will inform the therapist what it is that he wants and needs, and will accept that he will have to follow directions first to receive the desired item. With the patient expressing his needs, the therapist can understand what he is motivated for. And then they can both come to an agreement on the task to be completed, so that he can receive that reinforcement. As a consequence intervention, when the patient engages in noncompliance, the therapist must think of a game that the patient would be interested in, and an activity that will de-escalate the noncompliance. Once the game is finished, they will transition to the therapy room to work. The difference in the consequences is that we plan to eliminate the waiting strategy and encourage the patient to not engage in noncompliant behavior by encouraging spontaneous play. And that's just a way to keep the child engaged and active in the learning activity. Task list item H5 states plan for possible unwanted effects when using reinforcement, extinction, and punishment procedures. Problem behavior can increase in frequency when reduced by DRA due to reinforcement thinning and schedule thinning. And this is referred to as a treatment relapse. Problem behavior can increase when the treatment shifts from clinical settings to a natural setting, or when a new therapist is involved. Cooper et al. 2020. Break cards are a great way to teach children coping skills, but could increase escape behavior. They would be more likely to present that break card more often, because they know that they will be removed from the aversive task. Um, Being prepared for the unwanted effects of reinforcement and punishment procedures allows for BCBAs to develop effective antecedent and consequent strategies for behavior reduction. Going back to the unwanted effects listed from the case study, their treatment relapse, increase in problem behavior, avoidance of behavior, and over-reliance of reinforcement. My client was on a non-contingent reinforcement plan, and he abused that and would continue to expect his reinforcement time. So there, we had a hard time fading it away. So that's where that over-reliance of reinforcement can come into play. And then I knew of a child who did not like the overstimulation of being in the kid's kitchen, and so he just would go into behaviors to avoid the kitchen altogether. Wrapping up the last two BACB task list items, H6 and E7. H6 states monitor client progress and treatment integrity. Each intervention should be personalized for that patient. To ensure effectiveness, data must be collected and adjusted to meet the patient's needs. We must observe, collect, and analyze the data in order to provide an effective treatment for the patient. E7 it states to determine how to apply culturally sensitive interventions to your future practice as a behavior analyst. And it is important to self-reflect and recognize personal biases and cultural limitations. The client was an interesting case, and I had to practice cultural humility all throughout the time I spent working with him. By approaching patients with openness and willingness to learn, you create a safe space for them to learn and grow.